At the moment, in this country, we have about 1 in 8 of the population have a disability of one level or another. And as you know, the whole issue in relation to administration of disability organisations is a hot political topic at present. Can I ask you to consider one thing, Minister, and that is, how about bringing all of those Section 38 and Section 39 organisations, particularly the smaller ones, together into one building? Call it Ability House. It would significantly reduce the overall administration costs of those particular organisations. And there are plenty of publicly owned buildings out there that are going to become surplus to requirement as we downsize government. The one that springs to mind personally is Holles Street Hospital over the road here. Holles Street, along with the two adjoining properties at 65 and 66 Lower Mount Street, I think would be an ideal location to designate as Ability House and to bring all of the disability organisations together, all of them, into the one building. It's a wheelchair accessible building. It's right in the city centre of Dublin. It's easily accessible to public transport. We're spending at the moment, Minister, about €1.6 billion per annum on the disability sector. Hundreds of organisations receive state funding. The value for money audit that was done of the disability sector said that about 10% of the funding is going into administration and salaries for administrative staff. Now, you can't eliminate all of that, but you can eliminate some of it by actually bringing those groups together. You could definitely I can't get a figure in relation to it. I'm trying to, but it's not just the property and rental aspect of it, Minister, because you could reduce costs in relation to human resources, in relation to finance, in relation to procurement, by actually bringing these bodies into the one building. And if you take an example, Minister, when you're in Brussels the next time you're out there, that same idea has been used with women's organisations in Belgium, where they've all been brought in into the one building, under the one roof. It has significantly reduced the administration costs in Belgium in relation to those organisations. But more importantly, it has developed cooperation and synergies between organisations. And I think that is where we could actually develop a huge benefit for the disability sector here in Ireland, by bringing them all under the one roof so they can actually work together, cooperate together and develop synergies that would actually benefit the people on the ground, those that are actually the users of those services, and reduce bureaucracy and administration. And there wouldn't be a duplication of services either, that one organisation would see, well, look, the organisation in the room next door that's administered from that room, they can actually provide home health services to children with a disability far more effectively than we can, whereas we can provide some other service far more effectively and dovetail together. And I think, you know, it's the one thing that really frustrates families, is when they see large corporate buildings for the administration of disability groups around this country and here in Dublin, and yet there isn't money to provide an additional hour of home help for a child with a disability or someone else. And I think, you know, bring them all together in the one building. Holles Street is going to become surplus to requirement in a couple of years anyway. I don't think there's anything designated for it. In the short term, as leases finish in relation to existing premises in Dublin around that, they could be given temporary accommodation in some of the existing buildings and relocate them there when Holles Street becomes vacant.